A very warm welcome to all of you. I'm Dr. Ruhi Agarwala, co-founder, IAFM and Functional Medicine Clinic. I hope all of you had a great time yesterday with very insightful session from some of our very esteemed speakers. And today, again, will be a long day, and because it's packed one after the other with some very interesting speakers. We will kickstart the day with the topic of autism. So what really has changed that so many kids are being affected with autism? Why are children struggling, with conditions like autism, ADHD, global developmental delay? So if we see over the last few years, the genes haven't really changed, but the environment around us has changed. And so we have Dr. Ashwani Garg today, who will be speaking on epigenetic factors affecting behind the large numbers of autism that we see today. Dr. Ashwani, my husband, he is also the co-founder of IAFM and Functional Medicine Clinic. He runs an exclusive program called the Learning Disorder Program, which is for children on the autism spectrum. Over the last few years, he has worked with with a significant number of children and with very good clinical outcomes. With his keen interest in innovation and to bring back to give back to the society, he started a couple of ventures. Some of them are Dr. Juice, Functional Medicine Diagnostics, Wellfinity, and Autoimmunity Care. So I hand over to you, Dr. Ashwani. The floor is yours.
Thank you so much. Good morning, everyone. I hope I'll be able to deliver something useful to all of you, to the parents and to the fellow practitioners. Okay. So we in the conventional system, we are very good at, diagnosing the problem, but sometimes, we need to look a little beyond what is being told to us, and there are so many answers available. All the problems, all the sufferings in terms of the healthcare, it's not, we don't know, we're still saying that we don't know, but we have a lot of answers already with us. So that applies to autism, ASD, ADHD, GDD. There's so many answers available. Now, first, I want to tackle the issue of, all the chronic problems, be it diabetes, be it hypertension, be it hypothyroidism, be it IBS, IBD. We keep saying it is a genetic problem, but we don't look beyond what is affecting our genetics. Now, if you look around, so many kids, almost 1 out of 100 have a ASD, or 1 out of 8 almost have some level of a neurodevelopment disorder. So numbers are just staggering high, which is very, very unfortunate. And this gene theory cannot answer the growing number, because if you look around 30, 40 years back, hardly anybody will have a problem, or very few will have a problem. But today, every household, we see this problem is increasing, but there's no evidence to say that human genome have changed. Now, if human genome has not changed, then what has changed? So what is that is causing the problem today is what we need to figure out. If we get the answers to that, there'll be a lot of, practical tips you can apply to solve your child's problem. Okay, so genetics almost remains the same. Then what has changed? It's the epigenetics, the factors which influence our genes to manifest a disease or health. If we keep our epigenetics good, the factors which are influencing the genes, we will manifest health. But if we don't keep something that is nature has given us, okay, we have to maintain it well. So I'll talk about this epigenetics in a little more detail. Now, genes has not changed. Epigenetics certainly has changed big time. Okay. Today, we are not getting enough sunlight exposure. We're all inside, especially, in this Corona time, all of us were inside, we're locked inside, and always tube lights and LED lights and mobile screen, this screen, and hardly going under the sun. And this name has been given as a virtual autism. Okay, it's nothing but the environment which has led to the problem. The TV screen, the mobile phone, the Wi-Fi, the cellular network, the satellite network, the TV network, the wiring at home, they all produce electromagnetic fields which are unhealthy to our body, to the cells, to the mitochondria. And decreased function of the mitochondria is leading to increasing chronic problems in the manhood, in the mankind, also in the kids. Now, kids are at a much bigger risk of the problem. Second thing that has changed big time is the quality of the water that we are drinking. We are all drinking clean water coming from a reverse osmosis system, which is okay to have a clean water. We should have a clean water, but this same water is acidic in nature. This is unstructured water. Okay, it becomes an electron stealer. Our mitochondria needs more electrons. Then we have been using a lot of genetically modified cropping. The proteins in these genetically modified croppings is very new to our immune system. Our immune system cannot recognize, thus cause a lot of inflammation and autoimmunity. Of course, the processed food we are feeding, we just mean to feed their stomach. We don't think that it is good for them or bad for them. At the end of the day, parents think if the stomach is full with whatever nonsense, we're happy. But that is not helping the growth of the child. That is leading to the problems in the brain, in the body. And of course, in the recent times, last 20 years, number of vaccinations given to a child is also increasing. And we know for a fact that these vaccines have some level of mercury, some level of aluminium. And these are very, very toxic to the system, very toxic to the brain. And of course, it triggers an autoimmune response. I'll also connect some of the dots in the coming slides. Also, the number of pesticide, herbicide, fungicides, amount of antibiotics used. Now you see what has changed. These are the epigenetic factors which has changed over the last 20-30 years, which has led to the problem. Just problem is increasing and we don't know what to do with. Unfortunately, we're not even trying to connect the dots. But fortunately, science is evolving, our understanding is evolving, and we know many of the answers to solve such a problem. It's not a difficult problem to solve. Now, if you look at the image, just a blue light toxicity coming from the LED light, coming from the screens, coming from the different man-made electronic sources, which is emitting the light, which is a narrow spectrum of the blue light, can really make the mitochondria damaged. Size of the mitochondria can become smaller, thereby the cognitive abilities, the social abilities, all abilities of a child, also adult, can decrease. Now you see, this is the epigenetics. Now, just for parents, for all the practitioners, how is this happening in the body? What is the triggering factor? Now, like I mentioned, GMO cropping has increased, processed food has increased, vaccination has increased, contamination with glyphosate has increased. All of this will affect our microbiome and toxify the liver. Now, when we test all these kids, their liver enzymes are always high. We haven't seen any child with a normal liver enzymes. Now, when microbiome is affected with negative impact on that, then fungal overgrowth happens. All of these kids, they have a fungal overgrowth. That leads to mold colonization. That again leads to more GI inflammation. The intestines become more inflamed. As a consequence, there's something called leaky gut. As a leaky gut, more toxins from the intestine, from the digestive system start flowing into the bloodstream to the liver. As a consequence, poor liver is just in the process of cleaning. It depletes all its glutathione. Thereby, these toxins start flowing into the circulation, thereby start affecting other cells also. Then, thereby more histamine activation, then more immune suppression, then more fungal overgrowth. As the immune system becomes more poor and poor, you will see a lot of other infections start growing: parasite, virus, Lyme, mold, yeast, and all put together. Further damage to the gut-brain barriers, thereby more toxin to the brain. You see, amygdala, basic glia, different parts of the brain start getting inflamed, thereby symptoms are being shown by the child. Now, this is not just a behavioral problem that happens out of nowhere. Okay, so this is something that is talked to by Dr. Christian Bogner. He's a very, very good autism expert plus a researcher. So I have taken this information from him. So we know that there are issues. Today, we all are hell-bent on somehow getting pregnant, but females are not preparing their body for the right pregnancy. As a mother, you give yourself to the child. If you are healthy, your child will be healthy. If you are not healthy, how do you expect the child to be healthy? Now, a lot of research is coming. They're saying, if your body has toxins, your body has pesticides, your body has heavy metals, they all can go to your child. Thereby, growth of the child will be impacted. If you, as a mother, anybody has autoimmunity, your own immune system is doing a self-damage. Now, again, there are reasons of the autoimmunity, which you will learn in detail into the more sessions that we'll have today. All of these factors will also affect the child if mother is on any drugs. And of course, especially the infections in the mother, which is becoming extremely common because of the kind of food, kind of light, kind of water we are having. We are having chronic infections. Now, all these infections like viral infections, the streptococcus, measles, candida, all get transmitted to the child. Now, as a consequence, development of the child is impacted. When the child is born, then also we don't feed them well. We are keeping them under poor lighting. We don't give them enough sunlight. We are keeping them under a lot of mobile phones, lot of Wi-Fi. We think it is okay, but it is not okay. Then, of course, number of vaccination over a period of time are just increasing and increasing. Now, yes, there are certain vaccinations which are made mandatory by the governments, which is fine, but overdone, is it really helping? We really need to look back and see. Now, as a consequence, the child's detoxification, their metabolism, their mitochondrial function, their immune function is all impaired. Then along the side, somebody gets a viral fever, somebody gets a little bit of a cold, you go to a doctor and you prescribe with some antibiotics. Antibiotics, just like candies, or painkillers are just like candies. You have a little bit of a problem, take it. You have a little bit of fever. Fever is a healthy immune response by the body to protect us, but we don't allow the fever to happen. All the time we are giving paracetamols. Now, all these are the epigenetic factors for a mother and a child to have some problem. Okay, this leads to gut dysbiosis, this leads to immune dysfunction, all put together. The child increase of having a problem is just increasing. And you see, it is not unknown to us. We fairly know about it. Another issue today that I at least see is most of the time we think autism, ADHD is just a behavioral problem. They cannot socially interact, they cannot communicate, they are repeating things. We think is something behaviorally wrong with them. But we actually look a little deeper, we will see there are metabolic disorders. There is nutrition deficiencies in all of them. Their immune system is very, very poor. They get frequent sickness and allergies. There's a lot of infection. And a lot of them has autoimmunity. They're always stressed out. Okay, even though the kind of therapies today we are giving them, we keep enforcing, do this, do this, do this. They get more, stressed out. Then also the immune system become more downregulated. They have connective tissue problem. They have low muscle tone. 30%, almost 30% of them, some level of seizures and epilepsy, and of course, sensory processing issues. So they have multiple issues. You cannot just say that it is just in the brain and let me fix the brain, or it's a behavioral problem. If you have to make them healthy, you have to make their body healthy. Then only it will happen. So now Autism Research Institute describes autism as a whole body disorder. It's a disorder where biochemistry in the body is altered. That altered biochemistry in the body is affecting the brain. It is not just a brain problem. It is a bodily problem. So this is another key thing that a parent or a practitioner should think about. If you want to make the brain healthy, you have to make the body healthy. As a downstream, the brain can become healthy. If body is unhealthy, the downstream brain becomes unhealthy. So we should not make the body in the compartments. Okay, let me fix this or fix that. You have to make this complete body healthy. As a consequence, brain can become healthy. This is another very, very, a takeaway for all of us. Now, I'll just dig little deeper onto each of these epigenetic factors. Now, a few of them I have picked up, which will help you to understand. So, as the number of the electronic gadgets, electronic mobile phones, all these technologies are increasing, amount of exposure to the non-native electromagnetic fields that our physical body is exposed is just rampantly increasing. And you can correlate from the day these technologies have been come, the number of problems in the society are increasing. Also, number of kids having such a problem is increasing. Okay, I mentioned chronic problems are a problem. Big problem with these kids. Now, infections can happen just simply if we are under poor electromagnetic fields. So non-native electromagnetic field can cause growth of the pathogenic microorganisms, especially fungal infections, yeast infection. Just simply staying under poor electromagnetic fields, Wi-Fi, microwaves can disrupt our microbiome and cause us an infection. So it is that severe a problem. Okay. Also, the child's body is not fully developed. Their skull is not fully developed. They are at a much bigger risk of these electromagnetic fields. So 6-year-old child's body absorbs more 60% radio frequency from a cell phone or other wireless devices. Now, you see, their body is not fully developed. They're still under the growth period. And the impact of these electromagnetic fields is much, much more on them. So we have to be careful. Then, very, very important is the quality of the water. 80% of our body is simply water. If anything has to change, first thing is the water. Today, we are all drinking RO system waters, which is good. It is clean, but it is unstructured. It is acidic in nature. It's an electron stealer. Body needs electrons. We eat food to extract electrons. We go under sunlight to get more electrons. We drink water to get electrons. Water is just not something, without any energy. Water has energy. It has electrons. But unfortunately, we are drinking the water, which is stealing away our electrons. And that becomes a big problem. And we see kids, either they're drinking too much water or they're not drinking at all. But all of these kids, they are severely dehydrated. Doesn't matter how much water they're drinking, they are still severely dehydrated. So the moment we start improving their hydration with a good quality water, they start performing better. 80% of this body is simply water. The mitochondria, if it has to function normally, it has to be dehydrated. You see, quality of the water is having a big impact, and you can correlate from the day these RO systems have become very, very prominent into society. I'm not against it, but we have to do more things on the top of the RO system so that the water we drink finally is not acidic, it is structured, it is coherent. Our bodies are made of the nutrition that we take in for ourselves. A growing child has to grow new cells in the body. Our bodies would need continuous repair also. Now, if we don't have enough raw materials, to make new healthy cells, how will that work? We expect that we feed them any nasty food, and then we expect them they should have a healthy brain, healthy liver, healthy this and that. It doesn't happen. So all the time when we look at these kids, we test these kids, they are low on proteins, they're low on phospholipids, they're low on fatty acids, they're low on basic B complex, iron. Iron is very, very common. We are all in the wealthy families, and all of these kids, they're low on iron because we are cooking into non-stick vessels. We're cooking into vessels which doesn't give any nutrition, or in fact, they're giving us toxic waste. So that way, these kids are low on nutrition and they're not able to make healthy cells. As a consequence, their brain output is hampered, severely hampered. Then we are feeding our kids and ourselves with a lot of genetically modified foods. Dairy, wheat, soya. Our body cannot recognize the protein into these foods, and they start acting against these foods, and that leads to autoimmunity. Autoimmunity, one major reason is genetically modified foods. Then, of course, some certain food allergies, egg, fish, walnuts. It's not that these are bad things, but if your child is allergic to something which you're still feeding them, you know that after feeding that food, the child is not behaving properly, you need to take care of that. A digestive system is made to extract the nutrition and throw away the waste. This is how a digestive system is made. If our own digestive system start throwing the waste into our own bloodstream, what will happen? And same is happening with these kids. Their intestines are leaky. Okay, they start throwing a lot of toxins into our own system. Then to the liver, then to the brain, then symptoms. If we have to improve their brain, we have to improve their digestive system. It cannot happen that they have a poor digestive system where we expecting the brain to function normally. It doesn't happen. The healthy microbes play a major role for ourselves. If we have healthy microbes, they do a lot of good things for us. That is called gut-brain axis. The healthy brain, healthy microbes also will affect the brain activity. But we are taking a lot of antibiotics, we are taking a lot of pesticides, we're taking a lot of things which damage our own healthy microbiome. Now, when that healthy microbiome is damaged, we don't feed ourselves good, we don't take any fibers. This changed microbiome, which becomes more pathogenic in nature, where commonly in autism, we see Clostridia infection, we see Candida infections, we see a lot of parasitic infections. And this is called dysbiosis. And this infectious microorganisms start affecting the brain. So if you have to improve the brain, you have to clean these infections and re-establish the healthy microbiome. Then, of course, we're using a lot of things today into our day-to-day life, all the lotions and creams and all that, which affects our GI system, which affects our endocrine system. Antibiotics, antibiotics are okay for emergency use, okay for, when it is required, really necessary, but just any small thing you take antibiotic, you really do a damage to yourself. Acid blockers are a big problem. Gluten is a big problem. Painkillers are a big problem. Steroids, overuse of the laxative, high sugar diets, food allergies, big problem. And we're using our endocrine system, the hormones are for the cell-to-cell communication. We use a lot of body lotion, sunblock, pesticide, plastic, chemicals in the industrial and household use, meat which is not organic, dairy which is not organic. We're feeding a lot of the toxic waste which mimics like a hormone but does not function like a hormone, thereby whole endocrine system is also disrupted. So if we have to improve the kids, we have to improve the digestive system, we have to improve the endocrine system by ensuring we're not feeding them, applying them with a lot of nonsense. Then, of course, the toxic waste, which gives just like a mental stress, the toxic stress can also have a big impact onto the brain health. So heavy metals are major at the play. We see all the time lead, aluminium, mercury, barium, cadmium. A lot of these heavy metals are always there in these kids. The moment we start chelating, taking them away, they start getting better. Of course, the food additive, herbicide, fungicide, pesticides, a lot of these things in the society has increased over a period of like 30, 40 years, and we can see the results. So you as a parent, as a practitioner, you can really correlate where is this coming from. So this is another, very recent finding in the science, but probably we knew it always, but now it is recognized. It's called PANS and PANDAS. A lot of these kids have autoimmune problems already in the body. Okay, when we cannot look at in India, we cannot look at some specific antibodies in them, but when we look at their ANA, NTCCP, ATG, AMA, a child of 3 years, child of 4 years, they have high auto antibodies. Of course, if we start looking for specific antibodies, we'll find them the numbers should be very high. Okay, so autoimmunity, because of all the factors, because of the radiation, because of the poor water, because of the genetically modified foods, because of the chronic infections, because of the toxins, their own immune system start attacking their own self, especially the brain. And that's another major reason of concern in these kids. Thereby, a lot of issues, lot of symptoms. For example, perception, processing, and response can become bad because of the inflamed brain. Memory retrieval becomes bad. Attention focus becomes bad. Their sensory senses, sight, hearing, touch, smell, they're very, very picky eaters because of the inflamed system. They cannot bear certain frequencies of the sound because of the inflammation. There's a cognitive delay, there's self-stimulatory behavior, repetitive behavior, irritability, aggression, or seizures, which is very, very common. All the time, we do EEG and say this is a seizure and we put them on a drug, but we don't try to find why there is a seizure. Seizures can happen because there's an inflammation in the brain. You reduce the inflammation, the severity and the frequency of the seizure will come down. But at the end of the day, if we have to solve any problem, we have to find what is at the play. So just to summarize, there's oxidative stress, there's a dysbiosis, there's food intolerance, parasitic infections are a huge problem. Elevated histamines, low glutathione, increased toxic burden in the body. Of course, genetics might be a play, but not a big problem here. Low vitamin D, very low vitamin D basically means lack of sunlight, more exposure to the artificial lights. Then, of course, the mother was low on the nutrition. The folic acid becomes a big problem. Folic acid is synthetic B9 and really can cause autism in a child if mother has taken it. So if mother has to take it, it should be folate or methylfolate. And of course, the ability to detox the body in the child is really impaired. On the top of that, we are feeding them a lot of toxins. The system breaks down, thereby symptoms, not that there's only problem in the brain. So just to give you the glimpse of what can be achieved, all of us can achieve this. Okay, within 2 months. Yes, it's a long journey. It takes longer period of time to make recovery. Brain rewiring can take 9 months, 1 year, or more than that. Depends on how aggressively, how diligent we are able to follow these treatments. But it is possible to make this change and make the recovery in these kids. So 28% of them have the results that we have seen: speech and receptive understanding within just 2 months. Sleep improved, eye contact improved, stimming, compulsive behavior, hyperactivity, sociability, motor improvement, GI improvements. In all areas of their health, you can see improvement, significant improvement within 2 months, provided you follow it, provided you stick to the plans. There are so many factors which is affecting the body, thereby the brain. It's a lot of work for a parent to make this happen. But if you stick to it, make sure that you create the right epigenetic conditions for your child has to improve. Okay, there's no other way to it. The child has to improve. So this is some of the results that we have produced within a period of 9 months. We have been collecting data. Probably very soon we'll publish the data also. So ATEX score when we started about around 98 average, then 9 months dropped down to close to 60 or 65. So below 50, I think, is where when ATEX score is 50, you can say the diagnosis is dropped. So recovery in all of these kids is definitely possible. But we have to, as a practitioners or as a families, as a parent, we have to do the necessary hard work to make it happen. So just to summarize all of that, old perspective was it's a genetic problem. No, it is an epigenetic problem. Genetics, anyways, if it is a genetic problem, we cannot fix the genetics, but we certainly can fix the epigenetics. Thereby, genetics will manifest disease. So old perspective is a brain problem. And we are just only trying to fix the brain, but it's not actually only a brain problem, it's a bodily problem, it's a multi-system problem. So if you have to make the brain healthy, you have to make the body healthy. Then old perspective is it's a behavioral problem, but actually it's a metabolic problem. Mitochondria is at the play. Mitochondria is damaged. Then old perspective is autism is hardwired. Once it's happened, you cannot. Yes, some things might retain. At the end of the day, child should be able to function normally. That can happen. So it's a dynamic encephalopathy. It's not the once the damage is done, you cannot fix it. You certainly can fix it. Body is always regenerating. So always we blame the mothers for it. It's not mother's problem also. Just the environment as a whole society we have created, which is a problem, and we can certainly fix it. Autism can be recovered. We can help these kids to recover. Of course, earlier we intervene, the faster recovery and the complete recovery can happen. So these are some of the things that parents tell us. This is what they have achieved. Of course, it's an ongoing journey. It's not within a short period things will happen. But a lot of good, very, very positive feedback we get from the parents, and that itself help us keep working hard towards it. And I urge all the parents and all the practitioners who are listening to this, it is possible, people. It is possible as long as we are able to do the right work. It is not something that is mysterious. Okay. And anyways, I have a very, very esteemed panels coming up after my talk, where I will ask your questions to them. And there are much more experienced people and doctors than me. They will be putting more light and information on that. Thank you so much.